In the first video, we have seen the examination of temporomandibular joint. Now we are going to see the examination of muscles of mastication. The examination of temporomandibular joint is totally incomplete without examination of muscles of mastication. The temporomandibular joint examination comprises of two parts. One is examination of the actual joint and then examination of the associated structures with the joint. The associated structures are the muscles of mastication. Why they are called as associated structures? Because these associated structures only make the joint mobile. If you take away these associated structures, the joint will be totally immobile. So that is why the temporomandibular joint examination will always go hand in hand with the examination of muscles of mastication. When I am talking about the muscles of mastication, all of us will eat every day. Some of us will be poor eaters or they will eat in a very small quantity. Some of us will be binge eaters who will eat in very large quantity, and some of us will be a very hard foods eaters. Whoever or whatever may be the type of the eaters, it is only your muscles of mastication and the temporomandibular joint at the end of the day are going to become fatigue. Okay, it is the only function of this. It is one of the major function of this temporomandibular joint and the muscles of mastication. The key function is the mastication. Now we are going to clinically see how we are going to examine the muscles of mastication. See, the muscles of mastication basically are divided into major muscles of mastication and accessory muscles of mastication. The accessory muscles of mastication, we have very small role. Okay, we are not much bothered about the accessory muscles of mastications. We are going to bother about the major muscles of mastication, which are 4 in number: the musculature, the temporalis, the medial and the lateral pterygoid. Each of the muscle is unique. Each of the muscle has got a specific function and each of the muscle has to be evaluated clinically. Any key finding associated with the clinical examination of the muscle has to be evaluated thoroughly and very carefully for examination of any sort of muscle related disorders. Now I am talking about the first major most important muscle will be the masseter. A masseter muscle is a thick quadrilateral muscle that can be clinically evaluated upon clenching the teeth. If you have any doubt in locating where is the masseter, you yourself clench the teeth and hold your hand here. So you can feel a thick bunch of tissue that is being bulged out. Absolutely, that is the masseter muscle. Clinically palpating the masseter muscle is very, very easy. Ask the patient to clench the teeth or you yourself clench the teeth. There will be a bulge, there will be a tissue bulge. You can feel it very, very easily. That is what is the masseter muscle. So that is how you generally clinically evaluate the masseter muscle. Next most important muscle will be the temporalis. Next major muscle will be the temporalis. So clinically and technically how you are going to examine the temporalis. See, the temporalis is clinically demonstrated again by asking the patient to clench the teeth, and you have to only the difference between the masseter and the temporalis is the area of palpation. When you palpate it below, you can palpate the masseter. When you ask the patient to clench the teeth, when you palpate above the ears, you can palpate the temporalis. The temporalis muscle, unlike the muscle, cannot be palpated in a single isolated area. It has to be palpated in 3 different locations because the muscle will be resembling a Japanese fan shape. As a fan is widespread, this muscle will be widespread over your entire temple region. So this muscle has to be palpated for your anterior fibers, this muscle has to be palpated for your middle fibers and the posterior fibers. As I mentioned earlier, The only difference between the masseter and the temporalis palpation is the area of palpation. Ask the patient to clench the teeth. If you palpate below or around the ears, there comes the masseter muscle. If you palpate it above the ears, that will be the location of the temporalis muscle. Asking the patient to clench the teeth, you just place your finger anterior to the ear. You just place it anterior to the ear. You can palpate the anterior fibers of the temporalis. You just place your finger just above the ears. You can palpate for the middle fibers of the temporalis. You just ask the patient to clench the teeth, place the finger above the ears, and behind the ears you can palpate for the posterior fibers. So clinically there are three different fibers of temporalis. So you have to place your hand in front of the ear, above and in front of the ear for the anterior fibers. Ask the patient to clench the teeth. Above the ears you can palpate for the middle fibers, and above and behind you can palpate for the posterior fibers. Now that we have seen the masseter and the temporalis, now we are going to see about the most important muscles. Both medial and the lateral pterygoids are together combined. They are called as pterygoids. So clinically it is very difficult to palpate these muscles. When I am going to talk about the palpation, these two muscles, the masseter and the temporalis, can be palpated externally by asking the patient to clench the teeth and by your holding the fingers. Since these muscles are located inside, it is very difficult to locate these muscles. So how can I palpate these muscles? You can palpate these muscles by a technique what is called as functional manipulation. So what is functional manipulation? Functional manipulation is an indirect method to palpate these muscles. Now indirectly I am going to assess the functions of these muscles. Each of the muscle has got a specific function. By indirectly asking the patient to perform these functions, I am going to assess the condition of these muscles. Now that we have seen about the clinical examination of masseter and temporalis, now we are going to see about the clinical examination of the medial and the lateral pterygoids. Collectively, these muscles are called as pterygoids. These muscles play a very important role in mastication. The masseter and the temporalis can be palpated externally by asking the patient to clench the teeth. Since these muscles are located inside, it is practically impossible or it is very difficult to locate these muscles clinically. So how am I going to assess these muscles? Yes, you can assess these muscles by a technique called as functional manipulation. Now what is called as functional manipulation? To locate this muscle or to clinically identify this muscle, every muscle has got a unique function. Now indirectly I am going to assess the function of these muscles. By asking the patient to perform these functions, I am going to assess the condition of these muscles. Both the medial and the lateral pterygoids will contract and it will stretch. When the muscle will contract and when the muscle will stretch, that plays a very key role. As I said before, the temporomandibular joint has to be examined for both opening and closing the mouth. When you ask the patient to open the mouth very widely, always remember the medial pterygoid muscle stretch. Always remember, upon every wide opening of the mouth, there will be stretching of the medial pterygoid. If there is any pain on complete opening of the mouth, the medial pterygoid muscle has to be suspected for the possible source of pain. While clenching the teeth, the medial pterygoid muscle will contract. So the medial pterygoid muscle will undergo contraction and stretching. While opening the mouth, the medial pterygoid muscle will stretch. Upon clenching the teeth, the medial pterygoid muscle will contract. So, if there is any pain that is associated with clenching of the teeth, clinically we have seen the masseter muscle, we are palpated on clenching. Now, along with masseter, the medial pterygoid muscle will also contract on clenching. Any pain that is elicited on clenching, possibly two muscles has to be evaluated. One is masseter. Don't stop over there, because the medial pterygoid muscle also contracts along with masseter. Okay. So how to differentiate between the masseter and the medial pterygoid? Always perform the second function. Ask the patient to open the mouth widely. The muscle, remember, the muscle has got two functions. One is contraction, another one is stretching. If there is pain on contraction and stretching, always medial pterygoid has to be the source of pain. Next, coming to lateral pterygoid. Again, lateral pterygoid has similar function. One is contraction, another one is stretching. You have to know when does it contract and when does it stretch. The lateral pterygoid is a muscle which acts always opposite to that of the medial pterygoid. As I said, when the medial pterygoid, upon clenching the teeth, the medial pterygoid will contract. Now it is the vice versa or the opposite. What it will do is the lateral pterygoid will stretch on clenching the teeth. So when does the lateral pterygoid will contract? When does the lateral pterygoid will contract? When you ask the patient to move the mandible along the front, or ask the patient to protrude the mandible, there will be contraction of the lateral pterygoid. These are the two functions of the lateral pterygoid, which is very, very important. The lateral pterygoid will stretch and the lateral pterygoid will contract. You should know when it will stretch, you should know when it will contract. The lateral pterygoid muscle will contract when you protrude the mandible, and the lateral pterygoid muscle will stretch when clenching the teeth. So always remember, from masseter, from medial to lateral pterygoid. When you clench, you are clinically examining the masseter. Not only masseter, always remember two muscles are also involved in this same function. That is, the medial pterygoid muscle will contract and the lateral pterygoid muscle will stretch. So the clenching of the teeth is a combination of these three muscles. So how are you going to identify the culprit? You are going to identify the culprit by asking the patient to perform the second function associated with these muscles. You know the second function of the medial pterygoid. Upon wide opening of the mouth, it will stretch. So any pain that is associated with the stretching of the mouth, possibly the medial pterygoid will be the source of the pain. And any pain that is associated with protruding the mandible forward, possibly the lateral pterygoid has to be the source of the pain. So always remember, you ask the patient to clench the teeth, you can palpate the masseter. It is around the ear, it is for masseter. Ask the patient to clench the teeth, you randomly place your finger above the ear, so you are going to palpate for the temporalis muscle. Now, for the palpation of the pterygoids, both the medial and the lateral pterygoids, I am going to do a technique called as functional manipulation. In functional manipulation, you are not going to touch the muscle directly. Instead, you are going to assess the possible role of muscle by asking the patient to perform the functions of the muscle. The two functions generally associated with the muscle are contraction and stretching. That is the role of the muscle. Any muscle will contract and stretch. That is the function of this muscle. But you have to know when the muscle will contract and when it will stretch. The medial pterygoid is one muscle that will contract when you clench the teeth, and it will stretch when you open the mouth widely. The lateral pterygoid is one muscle. It will contract when you protrude the mandible forward, and it will stretch when you clench the teeth. So always remember, clenching is one common function for all the muscles of mastication. That shows the power of clenching. When you are going to eat, remember, you are going to involve these 4 muscles together. So always clench or chew with caution. Okay, because you are going to put all the 4 muscles into action. Now there can be a joint confusion that which muscle is involved, because while clenching, sir, I can feel for temporalis, I can feel for the masseter, I can feel for also the pterygoids. Yes, to find out the culprit, always assess for the other functions of the muscles. You have to, since, sir, why we have not mentioned about the functional manipulation of masseter and temporalis? It is very, very simple. Since you can locate the muscle in hand, there is no need for functional evaluation of these muscle. Any pain that is associated, the muscle itself will give a clue. When you touch the muscle, it will give you a clue for the pain. There is no need for functional assessment at all. The functional assessment is only need when it is practically impossible for you to locate the muscle or to touch the muscle. You have to assess the functions of these muscles. Okay. So whatever we have now discussed, I am going to practically demonstrate the clinical examination of the muscles of mastication. Now we are going to see the clinical examination of muscles of mastication. The muscles of mastications are totally 4 in number: the masseter, temporalis, medial and lateral pterygoid. Now we are going to see the clinical examination of each of these muscles in detail. The masseter muscle is, you place your fingers over the zygomatic arch, then slowly come down. You can feel a thick quadrilateral muscle or a tissue, that is your masseter muscle. Okay, this is your masseter muscle. Next, we are going to clinically demonstrate the temporalis muscle. The temporalis muscle is again demonstrated by asking the patient to clench the teeth. The temporalis muscle has got a wider area of distribution. It will be like a Japanese fan. It has got anterior, middle and posterior fibers. When the patient clenches the teeth, you just take your finger above the zygomatic arch and above the ear and place it anterior to the ear. Exactly here you can feel the anterior fibers of the temporalis. By placing the fingers exactly above the ear, you can feel for the middle fibers of the temporalis. By placing the finger exactly behind the ear, you can feel for the posterior fibers of temporalis. The masseter and the temporalis are user-friendly muscles which can be palpated externally, but the medial and the lateral pterygoids are located inside. It is practically difficult to palpate this muscle. See, this will be the location of the medial pterygoid, but there are numerous structures that overlap medial pterygoid, and this will be the position of lateral pterygoid. There will be numerous structures that overlap these muscles. Hence, it is clinically difficult to palpate these muscles. Now, for these 2 muscles, we are going to do what is called as a functional manipulation. A functional manipulation is a technique where the individual function of these muscles are assessed, and thereby we assess the performance of the muscle indirectly. The function of any muscle is contraction and stretching. Keeping these 2 things in mind, now we come to the function of pterygoids. Okay? Clench. The medial pterygoid muscle contracts when the teeth are in occlusion or when the patient clenches the teeth. Open the mouth. The medial pterygoid muscle stretches when the patient opens the mouth. Close. Okay. The lateral pterygoid, bring your mandible forward. The lateral pterygoid muscle contracts when the mandible is brought forward. Clench. The lateral pterygoid muscle stretches when the patient clenches. Keeping these things in mind, now we are going to assess the functional capacity of the muscle. When the patient clenches the teeth, he will have either no pain or pain. Yes. If the patient has got pain on palpation, you just have to think about three muscles. One is the musculature, another one is the medial pterygoid, another one is the lateral pterygoid. Why not temporalis? The location of temporalis is totally different. Okay. Now, how I need to find out the source whether the medial pterygoid or lateral pterygoid is involved. Okay. Along with this clenching of the teeth, assess for another performance. Open the mouth. If medial pterygoid is the source of the pain, opening of the pain along with clenching will definitely cause pain. So, there will be pain during clenching as well as opening. Okay, close. How to identify if lateral pterygoid is the source of the pain? Ask the patient to protrude against the resistance. While performing this function, the patient will definitely have pain. Okay. By keeping these things in mind, how to differentiate between whether the pain arises from the muscle or the pain arises within the joint, it is as simple as that. Take a separator like this. Okay. Ask the patient to clench the teeth. Clench. Ask the patient if he feels any pain. If the patient says yes, ask the patient bite. To bite on the separator. While biting on the separator, if the pain is doubled or if the pain increases, definitely the pain is of muscular origin. If joints are involved while biting on the separator, the patient will not feel any pain at all. If there is doubling of pain or if there is increased pain, it is of muscular origin. While biting, if there is no pain, definitely the joint is involved. So, this finishes the clinical examination of muscles of mastication.